Good morning, everyone. Thank you, President-elect Gordon, for your gracious introduction and for your very moving and poignant story about your brother Ian. You are paying the greatest possible tribute to Ian's memory by using your platform to promote mental health care for our members and the people that we serve. Thank you for your courage and your remarkable compassion. I also applaud you for your vision in taking bold and unmatched steps to talk about critical unmet mental health needs across the globe. I express my deepest appreciation to you for having me talk today about mental health, a topic that has been so taboo for so long. My brothers and sisters in Rotary, there is no health without mental health. Radha, in the village of Mugalur in southern India, was married in her teens to a total stranger. After her first child, her husband disappeared with their infant, while she suffered from severe postpartum depression. With outreach by our trained village caseworkers and clinical care, Radha recovered. Today, she works to support herself, and her community keeps an eye on her. They are her support network, educated by our integrated care clinic workers. Shamika in Baltimore, USA, saw her neighbor's 5-year-old girl shot dead in front of her eyes. Her house was broken into, and she was assaulted. She suffered from post-traumatic stress disorder, but had no clue that the symptoms that she had a name and a term. With psychiatric care consisting of both medications and therapy, Shamika got better. She's well, and she's now a spokesperson for the National Alliance on Mental Illness, or NAMI. She's very proud of her job, teaching others how to care for themselves. Patrick, a college-educated man, no less, in Kenya, had schizophrenia. His family couldn't manage his symptoms. He didn't know how to communicate being ill. He was aggressive, and his family had him in chains, locked away, imprisoned behind closed doors for, listen to this, for 15 years. With one medication that we gave him, just one at bedtime, in a few weeks, Patrick was well, no longer in chains, back to his normal self, cheerful, smiling, roaming around the village. The villagers thought we had wrought a miracle. And amazingly, the nurse, my nurse from Hopkins who worked with me, his name was Moses. So of course, they thought it was a miracle. In Lithuania, Rotarians were seriously concerned about the dire state of their youth who were dying by suicide at 4 to 6 times that of the United States. Past District Governor Vygantas Grinis, my husband, past District Governor Jay, and I partnered with Rotarians from neighboring countries to help. With support from the Rotary Foundation through a global grant, we were part of a countrywide effort with numerous other partnering agencies, stakeholders, and the Vilnius University School of Public Health, the oldest in Europe. We provided suicide hotlines and a workable system for care and treatment. This collective effort contributed to the significant decrease, and I'm talking statistically significant decrease, in suicide rates in 14 districts in Lithuania, saving thousands of lives. As I speak, Rotarians are working with me on a global grant to provide both access to care and treatment for epilepsy in children in Zambia. With the right resources and training, epilepsy is an easily treated disorder that prevents the children typically from going to school or their mothers from going to work. In my lifetime, I have treated both princes and paupers. their sense of shame about mental illness is nevertheless identical. The wife of a Saudi prince that we treated at the Johns Hopkins Hospital in Baltimore successfully for bipolar illness was hidden by her family in her home. They never reached out anywhere for help until they came to Baltimore. Now, why had this woman suffered unnecessarily for years when there were clearly viable treatments? Why had all of the people in the examples I shared with you suffered unnecessarily for years? I'll tell you why. Several factors apply to all of these countries, rich or poor. First, a lack of awareness of what constitutes a mental disorder, needing both discussion openly and education. Second, very strong shame and stigma that prevents people from asking questions. And third, a critical lack of access to care. What we found through research across the globe is that both anticipated as well as experienced discrimination due to mental illness and the fear of being stigmatized are major obstacles to obtaining help. So let's begin, as Gordon has said, by talking about it. The World Health Organization targets mental illness and substance abuse or drug abuse as a critical component to Sustainable Developmental Goal number 3, which is good health and well-being. The world over, depression and alcohol abuse are the number 1 and number 2 disorders everywhere. Mental illness is both recognizable and treatable. Without treatment, it simply robs us of who we are. Our patients become, without care, mere shadows of themselves, mutely suffering. Had their families and communities been educated, and had their neighbors been taught, had they felt safe and comfortable talking about their feelings, emotions, and well-being, and had accessible services existed, they would have never taken their lives. They would have obtained help sooner. Presidents of countries, Nobel Prize winners, and Hollywood stars have been fully treated and have led immensely productive lives. I have treated several of them. Our community health workers, colleagues, fellow Rotarians, Rotaractors, and family members can be taught to identify signs and symptoms, support their communities and loved ones, and get them back to feeling well and healthy as we would anyone who has diabetes, heart disease, pneumonia, hypertension. We need to discuss mental health on the same platform as physical health. Alzheimer's disease, post-stroke depression, depression caused by AIDS, COVID, multiple sclerosis, Parkinson's disease, cyberbullying, or substance abuse, they're all open for discussion. We need to disseminate information about these conditions and guide people to care and treatment. Now, mind you, psychiatry is a somber topic, but not everything is serious. A lot of levity has been, in my experience, in my career. To give you an example, Morris, an 80-some-year-old man, had lost his lovely wife, Betty, after 60 years of marriage and was very despondent for a long time. One day I saw him on Main Street, hopping and bopping around with this young, attractive woman on his arm. Morris was a bit hard of hearing. I said, "Morris, you look really perked up." He says, "I did what you asked me to do, Doc. You said, go and get yourself a hot mama and be carefree." I said, "Morris, that isn't what I said. I said, you have a heart murmur, be careful." So I derive a lot of joy from my patients. Now, A number of Rotary action groups are already existing. Groups for addiction, Alzheimer's and AIDS, and multiple sclerosis. Your clubs and districts are encouraged to partner with Rotary action groups to learn about how to take sustainable action. Through my work for over 3 decades and in 4 continents, I can confidently tell you that we can successfully raise both awareness and knowledge through outreach and repeated education, and we can provide access to early intervention, prevent relapse, and prolong well-being and gainful employment. It is possible. Even before the pandemic, there was a critical unmet need for access to mental health care and to care providers. During the pandemic, in the US, a wealthy country, 40% of people surveyed reported anxiety and depression during the pandemic, and close to 50% of them couldn't access care. That is indeed tragic. The first task then is to raise awareness about the need for mental health, as Gordon is very successfully doing. The second is to educate ourselves about it. And third, to increase funding for and improve access to mental health care. This can certainly be done via global grants and partnering, and I'll explain that in a minute. For the first time in the US, we now have a suicide prevention hotline. The 988 nationwide number assists not just adults, but also our youth and teens who are our future and the engines of the world. We must assist our healthcare workers, doctors and nurses who were under tremendous strain during COVID, who suffered greatly, and they too needed and do need peer support. In the recent unprecedented pandemic, we all experienced losses, grief, anxiety, and sleepless nights. The question is, what role must you as Rotary leaders play in creating a space where we can show up for and take care of one another and to advance prevention and treatment? Gordon is emphasizing the fact that we must take care of ourselves first. Now, what does that entail? Have a regular schedule. Get enough sleep, roughly the same time at the same amount daily without irregularity, without working on or watching TV or eating pizza in bed. Travel schedules that are erratic can cause a permanent jet lag-like status, affecting both your mind and your mood. Now, research shows that your workday cannot be infinite. Take some time to calm down, practice mindfulness, and focus on relaxing your mind and your body. There are easily downloadable free mobile apps that help with this. Watch your diet. I can't say that with all the food they've been giving us here, but watch your diet. Do not drink excessively. That means, and 1 drink for a woman per day, 2 for men. Hey, I'm not saying this because I'm a prude. That's what the research shows. Maintain good physical health. Exercise. Get help when you need it by having a support system for yourself. Now, that may be 1 or 2 peers you trust, or a counselor, or a religious leader, or anyone else in a position who can give you advice and support you. Burnout was common during the pandemic. Burnout is a lack of enthusiasm for your work, decreased productivity, lack of compassion and empathy, peer conflicts, mental and physical fatigue caused by long work hours, insomnia, and organizational or systemic problems. Avoid Rotarian burnout. You've already heard that once today. If you as leaders don't talk about mental health, yours or anybody else's, how then do you expect others to do this? So what can we do in our own districts? The Rotary Action Group on Mental Health Initiatives, which we founded in 2015, now has over 180 members, growing rapidly from over 30 countries, working all over the globe, serving as a resource to clubs and districts in this space, gathering and sharing best practices. We are encouraging the formation of district chapters, typically led by mental health providers and supporters. We are encouraging articles in district newsletters that we disseminate with timely information. Form partnerships with agencies like the National Alliance of the Mentally Ill or any other agency that will work with you. There is plenty of available printouts, handouts, information for families and consumers at the websites of many national and international organizations like the American Psychiatric and Psychological Associations, British Psychiatric Societies, other entities in the UK. Now, these links are on display, not just on their website, but on our RAGME website with a resource tab where you can download all of the teaching materials. The American Psychiatric Foundation handouts are also translated into Spanish. We're making a concerted effort to do them in other languages. Now, hope is a central theme here. I want to tell you, psychiatry is a very young science with exciting possibilities. Today, we have productive research in genetics, psychopharmacology, epigenetics that studies the impact of environmental factors on our genes. We now know which gene carries a site that predisposes to suicide. We have it identified at Hopkins. The genetic loading that causes psychosis, and the genetic predisposition to postpartum depression. Imagine how much we can do if we identify this early. It's only a matter of time before we have these diagnostic tests available to you. We also know which medication will work for particular patients and ethnic groups, how the brain morphology changes with treatment when we return to full functionality. Most of all, our greatest hope for our patients is the emergence of medications that are so finely tuned and researched that we can eliminate depression in hours. Not months, not weeks, not days. Imagine, hours. Moreover, we are able to administer medications via intravenous infusion that not only change the mood, but imbue the patient with a sense of calm, equanimity, and a universal love of humankind, even among those who are suffering from terminal cancer or intractable pain. It's like prolonged transcendental meditation. Neurobiological studies also show that the practice of giving, a core value of Rotary, and behaviors like fairness, cooperation, and reciprocity are intrinsically rewarding. Giving, which we teach and practice, increases levels of 3 critical neurotransmitters in the brain: dopamine, serotonin, and oxytocin, or the cuddle hormone. They're called the happiness trifecta. That leads to better emotional health. Think about it, my friends. Rotary has managed to do what countries, ministries of health, and academic institutions did not do by themselves. So let us talk about good mental health. About Radha, this young woman I have followed for over 2 decades in the village of Mugalur. She has been through unbelievable tragedies. And yet, when we go to see Radha in her humble home that's not more than 10 foot square, one faucet in the corner for both her bathing and cooking, one makeshift clay stove in a corner, packed mud covered by cow dung paste to keep the insects out, a bamboo mat rolled out for us to come and sit on. rather receives us like royalty. She has a smile on her face. She's running about frantically trying to arrange things in her little home, making us comfortable. She runs to her neighbors to get some snacks to give to us, wants to make tea for us. This woman who had absolutely nothing welcomes us as if we deserved so much. She imparts such grace and dignity in this very little, tiny house that we are absolutely touched. The gratitude she makes us feel for the way she treats us is immense. You cannot walk away without feeling like you are indeed a prince or a princess. In that moment, where Radha is squatting on that bamboo mat with me, talking about her life, there is nothing that separates her and me. Radha and I are one. That is the reason I practice psychiatry. It is an immense joy to see Radha transformed into who she is. I could tell you a whole story about the travails of her life, but the generosity and the dignity that she gives us is incredible. So I say to her, Radha, you worked so hard. You walked 6 miles to your job in that little nursery where you're planting seedlings. You needn't have walked back 6 miles to see us. And she says, you come each year from 10,000 miles away, doctor. What is 6 miles? So let us talk about good mental health. As Gandhi said, be the change you wish to see in the world. Thank you, my brothers and sisters in Rotary.